Hi, this is Dr. Eric Thomas talking today about a special treatment mainly for psoriasis, although it crosses borders into other fields of medicine. I'm talking here about biologicals, well, what we call biologicals. I like to think of them as affecting the process, the inflammation, the irritation that occurs when things get out of whack. You know, in psoriasis, but also in arthritis and certain other conditions, your immune system is overreacting. It's an important part of our anatomy. Without it, we'd be sitting duck for every germ that came along. But unfortunately, sometimes, for reasons we can't fully understand, our body's immune system decides it doesn't like our skin, something of that nature. So in the old days, if we wanted to try to calm down the overreactivity of the skin, we had to use very broad chemicals. Some of them are very dangerous. Methotrexate was an old one, and it could cause all sorts of problems with the liver and so forth. People died from the misuse or overuse of methotrexate. And it's a good medicine, and there are places where it still serves an excellent role, some degrees of cancer, and I believe rheumatologists often use it successfully. And it can be used in medicine. It, however, has been pretty much superseded by a safer group of medicines, which have a confusing potpourri of names and so forth. Enbrel, Humira, Skyrizi, Cosentyx, Taltz, and others. But I'm not going to try to pick out one favorite. I do have a favorite, but I won't pick out one favorite because this is almost a moving target. It changes depending upon research. These products short-circuit some of the inflammatory chemicals. They're called interleukins, ILs for short. There's an interleukin 17, an interleukin 23, and therefore if one does not work, another one might. And sometimes one stops working, so a change, a well-educated change may make sense. How do they work? As I've said, they pretty much calm down the immune system. Unfortunately, most of them are large molecules and are not absorbed well through the intestines, so most of them are injections. Now they have some very nice self-injecting or injecting in the office where you really don't even see the needle. There can be once or twice a month. There can be once a month. There's one that's every 3 months. So the only thing that really has to be done is to rule out some hidden infection. So we usually like to do a blood test to make sure there's no hidden tuberculosis. If there is, they can still be used, but other medicines may have to be taken at the same time. We may repeat that once a year or so because people are exposed to tuberculosis in the environment. Other than that, there's a pretty well tolerated. I've seen remarkable effects. I've had one person who went from 30% of the body covered with psoriasis to almost clear within a month. That's a little unusual, but it can happen. Cost. Yeah, these are pricey products. There are all sorts of issues with getting people on them. Insurance almost always will cover it. They sometimes require one versus another. There also are programs from the manufacturers that are pretty generous that we can help you get on. So if you have psoriasis, and especially if you have arthritis associated with it, well, we in this office primarily treat people for the skin disorder psoriasis. Some of these are also fairly effective to very effective for psoriatic arthritis. I remember one person who came in and said, wow, my skin is better, but I had not realized how achy I was. I've been far more comfortable with my joints and flexibility since going on the biological for psoriasis. Hope that clarifies some of the issues and may make you a little more comfortable with this as a form of treatment for psoriasis. It really can help you. Eric Thomas again. Thank you.